Hello, this is Dr. Stephen Morris. I'm continuing with the Anatomy and Physiology lecture series. Today we will be discussing the axial skeletal system. To begin with, I'm going to show you two views here of the skeletal system. This is an anterior view to the left of your screen, and this is a posterior view of the axial skeletal system. Now, from these anterior and posterior views, you can see the bones that are associated with the skull, which are not quite visible, and then in the anterior view of the entire skeleton with the axial components highlighted, there are a number of bones that are involved in this skeletal system. The axial skeleton itself is composed of 8 cranial bones and 14 facial bones. Again, from those slides, you can't visualize all of the bones that are associated with the skull, but on some additional views that I'll give you in some subsequent slides, you will be able to clearly identify all of the bones that are involved in the skull. But 8 cranial bones and 14 facial bones comprise the skull. There are also bones associated with the skull that are involved in hearing. So 6 auditory ossicles are also involved in this. A much smaller bone, referred to as the hyoid bone, is also a part of the axial skeletal system. The other bones involved include the thoracic rib cage. There is the sternum, which is the central bone, or the breastplate is another name that's given for it, and there are 24 associated ribs. There's also the vertebral column, which involves 24 vertebrae, the sacrum, and the coccyx bone. Again, this is the axial skeletal system, both an anterior view and a posterior view. Now, this is a highlighted illustration from your textbook, again demonstrating the axial skeletal system. Again, you can see the skull. You can't clearly visualize all the bones that are associated with the skeletal system, at least the skull on this picture, but we'll go into more detail in subsequent slides. Again, the bones associated with the chest wall, which include the ribs and the sternum. The sternum is broken up into 3 parts, which we'll discuss again in some subsequent slides. And then the vertebral column, the coccyx bones, and the coccygeal bones, and the sacrum, all a portion of the axial skeletal system. We'll first start talking about the skull. The bones of the skull protect the brain and guard the interests of the digestive and the respiratory system. The skull also contains 22 bones, 8 form the cranium or the brain case, and then 14 bones are associated with the face. Again, the bones of the skull protect the brain and they guard the entranceway of the digestive and the respiratory system. This is a lateral view of the bones of the skull. You will be responsible in your laboratory assignments to be able to clearly identify the bones of the skull. You'll also have to be able to label these same bones on examination. Bones of the skull include the frontal bone, the temporal bone, the parietal bone, and the occipital bone. Each of these bones have landmarks on them as well. Some bones that you can't clearly visualize on this slide will be the sphenoid bone and the ethmoid bone, but I'll show you those bones on some other views so you can clearly be able to identify them. As far as the facial bones go, as you can see, there's a lacrimal bone, nasal bone, zygomatica bone, the maxillary bone, the mandible. All are facial bones that are associated with the bones of the skull. This is both a posterior view here on the left and a superior view on the right, also identifying some of the bones that we've already discussed. The parietal bones, there are 2 parietal bones. There is the occipital bone, which lies posterior and inferior on the skull. The temporal bone, which now you're seeing from a posterior view. You had a better image of it when we looked at it laterally. And then there are some bony prominences and landmarks on these bones that you will be responsible for identifying as well. For example, the mastoid process, the styloid process, the occipital condyle, which is a bony projection from which muscle and ligaments will attach to. There's an external occipital protuberance, Again, ligamental structures will attach to this portion of the bone. There are also features noted on the superior aspect of the skull that are also important to recognize. There are suture lines or fusion points between the two bones of the skull, the two parietal bones of the skull, the sagittal suture. This connection between the occipital bone and the parietal bones referred to as the lambdoid suture. And then there is a suture that joins both the parietal bones with the frontal bone, and that's referred to as the coronal suture. These are all structures and landmarks that you will be required to identify in gross examination. You can also see superiorly the zygomatic bone and just the tip of the temporal bone that we've identified earlier. This is an up-close lateral view of the bone. Again, this is a good view to study because it identifies the majority of the bones of the skull that you'll be required to identify. A couple of other points I'll just point out. Throughout the skull and throughout many of the bones in our body, there are tiny little openings, little holes that are referred to as foramen. As you can see here on the mandible bone, I'm pointing to the mental foramen. Blood vessels and nerves pass through these little tiny openings, these little tiny holes. Blood vessels and nerves pass through those to give blood supply to tissue structures that sit on the outside of these bones. Throughout the skull, and I'll show you on some additional pictures, there are these little tiny openings, foramen, throughout the system, throughout the skull, the skeletal system, that supply blood to tissue areas that lie adjacent to the bones. There is also an opening, as you can see in the temporal bone, referred to as the external auditory canal. In some textbooks, it may refer to this as the external auditory meatus. There is also an internal acoustic canal or an internal auditory meatus, which are involved in the auditory processes of the human body. This is an anterior view of the skull. Again, some bones that we weren't clearly able to identify in the previous slides you can identify now. The nasal bones are clearly prominent as anterior structures. There are also bones inside the nasal passages referred to as concha. There is a superior, middle, and an inferior concha. You can easily visualize the inferior nasal concha and the middle concha, but it may not be as easy for you to identify the superior nasal concha because the nasal bones block visualization. You can also get another view of the ethmoid bone from the anterior view. Again, this is not a good view of the ethmoid bone. We'll actually have to remove portions of the skull to be able to clearly visualize that, and I'll be able to demonstrate that to you on some subsequent slides. There's also a better view here of the zygomatic bone. Also, there is a better view of the maxillary bone, as you can see it in full frontal view. The frontal bone itself is better visualized here. You can see the frontal margins of the temporal bone and also the frontal margins of the sphenoid bone. But again, for the sphenoid bone, similarly to the ethmoid bone, we'll have to remove some of the other portions of the skull to be able to clearly visualize that bone. And then, again, I want to point out foramen. This is the supraorbital foramen that's located here. Again, a little tiny opening where blood vessels and nerves will pass. This is the infraorbital foramen. Again, blood vessels and nerves will pass through this opening. And on the previous slide, we had already identified the mental foramen. But there are multiple foramen in the skull. Again, purpose is to let blood vessels and nerves pass. This is an inferior view of the skull. Again, some key bony landmarks that you should be able to appreciate. We've talked about the sphenoid and the ethmoid bone previously. This gives you a much better view of the sphenoid bone, again from the inferior view. There will be some additional views of the sphenoid bone coming. As you can see, it expanses most of the inferior surface of the skull. There are a number of tiny openings in the sphenoid bone. The foramen ovale is one example of a tiny opening in this bone responsible for passing blood vessels and nerves. There are also major openings referred to as the foramen magnum. This is a significant opening in the inferior aspect of the skull, specifically opening in the inferior aspect of the occipital bone. Again, it's where blood vessels and nerves will pass, but now this is one of the major nervous tissues will pass through this opening. The spinal cord will pass through the foramen magnum. Also, the associated blood vessels to provide blood supply to those portions of the nervous system. There are also additional foramen that you'll have to be responsible for identifying: the jugular foramen, the carotid canal, the foramen lacerum. These are all openings that you would be responsible to identify. The styloid process, you can see better from this inferior view as well, connects to the temporal bone. These processes will be named throughout your study of the skeletal system. Processes typically are structures that project from the bone, sometimes at a perpendicular angle, sometimes not, but they are projections from the solid body of the bone. This is a lateral view. A sagittal cut has been taken from the bone. You can actually look into the inside of the skull now. Appreciate the grooves that are in the bone as well. These grooves are where blood vessels will lie and course inside the skull. Again, you can get a much better view of the sphenoid bone. You can also get a much better view of the medial surface or the inside of the temporal bones. The ethmoid bone also is clearly visualized on this photograph. This is a superior view after a sagittal cut. You're actually looking down into the floor of the skull. Again, to orient yourself, the foramen magnum is in the occipital bone, which is the posterior bone of the skull. So when you see the foramen magnum, you know you're toward the posterior aspect of the skull. Again, we're looking into the floor of the skull. You see many grooves where blood vessels would lie and course. You also see the smooth fossa areas, smooth flat spaces of the bone, the fossas where the parenchyma of the brain would rest. You also now from this photograph get a much better picture of the sphenoid bone. The whole structure kind of looks like a bat flying. In this groove of the sphenoid bone, this is the sella turcica. This is the point where the pituitary gland would lie in the bone. The ethmoid structure is still notified here above. There's also a portion of the ethmoid bone referred to as the cribriform plate. This is important because the epithelial tissue and the nerves that are responsible for the olfactory sensation lie in the epithelial tissue of the cribriform plate. There is a bony projection that comes from the ethmoid bone referred to as the crista galli. The foramen that we looked at on the inferior aspect, we can also now look here from the superior location. We also see a number of foramen. The foramen ovale, which you saw from the other side, the foramen spinosum, and the foramen rotundum. You would be responsible for being able to identify these structures. So, as we talk about some of the bony structures, when two bones meet at a particular area, they form a joint. Some of the joints that we'll talk about are points of articulation between two bones. In the skull, we'll first start off by talking about the temporomandibular joint, or the TMJ. Between each of the temporal bones and the mandible is quite mobile joint, which allows the jaw to move while we chew and talk. Now, there are some disadvantages to this motility in that the jaw can easily be dislocated by a forceful lateral displacement. So a punch to the jaw can cause displacement of this joint. The connective tissue sheet, or the capsule that surrounds the joint, is relatively loose, and the opposing bone surfaces sometimes are separated by a fibrocartilage pad. Well, not sometimes, they are separated by a fibrocartilage pad. Now, there is a particular syndrome referred to as TMJ, or temporomandibular joint syndrome, which is associated with significant myofascial pain. The mandible is pulled slightly out of alignment, generally by spasms by one or the other jaw muscles. The individual that suffers from this will experience facial pain that radiates around his ear and affects the side, can even go and advance to a point at which the person has an inability to open the jaw or the mouth fully. TMJ syndrome is a repeating cycle linked to involuntary behavior such as grinding of teeth during sleep and emotional stress. Treatment focuses on breaking the cycle of muscle spasms and pain, when necessary, providing emotional support. The application of heat to the affected joint, coupled with the use of anti-inflammatory drugs, local anesthetics, or both, may help. If teeth grinding is suspected, special mouth guards may be worn at night. The occipital bone, which you see in this slide, forms the inferior and the posterior border of the skull. Looking here closely and identifying the occipital bone and noting its location on the illustration above helps you to clearly identify its location. Again, the inferior and posterior border of the skull. There are several landmarks that are important for you to be able to recognize on this bone, the first of which includes the foramen magnum. This is a large opening through which the spinal cord passes as it communicates with the brain and passes inferiorly through the point of the spinal canal. There's also the external occipital protuberance and the external occipital crest, both of which are points for muscle attachment. There are also occipital condyles. These are points of articulation where the two bones of the occipital bone and the vertebrae will meet and rub together or articulate at the occipital condyles. The other bone that I'll ask you to be able to identify would be the parietal bone. There is a parietal bone that makes up the lateral and the superior aspect of the skull. This view demonstrates the right lateral aspect and superior aspect of the skull. In a different view, we could see the left lateral and the superior aspect of the skull are developed by these two bones. It's important to note that the parietal bone only makes up part of the lateral surface. The remainder of the lateral surface of the skull is made up by the temporal bone. The occipital and parietal bone general functions. The occipital bone forms much of the posterior and inferior surface of the cranium. Points of articulation. The occipital bone articulates with parietal bones, the temporal bones, the sphenoid bone, and the first cervical vertebrae. The first cervical vertebrae is referred to as the axis. I'm sorry, I said axis. The first cervical vertebrae is referred to as the atlas. The atlas. General functions. Parietal bones form part of the superior and lateral surface